Okay, so go ahead and do a countdown, 3, 2, 1 for yourself.
Knock, knock, knock.
Hi there.
Good morning.
Good morning.
How are you doing? My name
Very-
is Tina. Okay. Just let me finish talking.
Yeah. We don't have to cut that. I can cut it.
Okay.
Okay, 3, 2, 1, go for it.
Knock, knock, knock.
Hi there.
Good morning. How are
Good
you
morning.
doing?
Doing very well.
Good. My name is Tina. I'm going to be your nurse today.
Thank you.
Can I get your name and date of birth?
Stephen Hatfield, 41074.
Perfect. What are we seeing you for today, Stephen?
Just a yearly checkup.
Okay. Perfect. I'm going to go through a lot of questions and a lot of checkup things with you today. But
Okay.
first, I want to make sure that you consent to the head-to-toe assessment. I'm going to be touching your head, your face, your ears, your back, your chest, your legs, your feet.
Sure.
You're okay with that?
Absolutely.
All right. Are there any cultural or religious things that I need to be aware of today?
Not at all.
Okay, perfect. First off, let's start with your age. How old are you today?
I'm 50.
Lovely. I am too.
Hmm.
All right. Are you single? Are you married?
I'm single in a relationship.
Okay. And what do you do for a living?
I'm a contract specialist.
Okay. What does that mean?
All the things that you skip through when you're on your phone and you say, I agree, I agree, I agree. Those are the things that I read.
Oh,
And I
thank you, sir.
and I agree to those on behalf of a company
Okay, great. And where do you work at location-wise?
in Seattle.
In Seattle. Do you live locally here?
I live locally here, in Southwest Washington.
Yeah, that sounds like a really long commute to
I,
Seattle.
I telecommute quite a bit.
Oh, well, that's fortunate then.
Right.
All right, so you telecommute. Do you live in a house, an apartment?
I live in a house.
Okay. Do you live by yourself? Do you have
I,
kids?
I don't. I live with my significant other
Okay.
and her elderly parents.
Oh, all right. Circle of life.
It is.
All right, wonderful. All right, Stephen, are you taking any medications currently, prescription or over the counter?
No, not at all.
No Tylenol for headaches?
Tylenol and ibuprofen as needed.
Okay.
Just aches and pains.
Aches and pains. We are 50.
Yeah.
All right. Any food or drug allergies?
No.
No. Okay. You're not taking medications for anything, but is there anything that you've been concerned about? Have you had, chest pain, back pain,
No.
coughs, anything like that?
Gosh, just recently, maybe a little bit of phlegm, but I took anti-phlegm and it
Okay.
worked out.
All
I
right.
think it was a cold.
Okay. Good deal. Any surgeries in the past?
I've had a couple of surgeries. I've had 2 on my left knee, 1 on my right knee.
Okay.
Those are arthroscopic, so just
Okay.
going in there, cleaning up, making sure everything's good to go. I've had 2 back surgeries.
Oh, what kind of back surgeries?
It's L4, L5, and L5S1, both times. The first one, the surgeon did a great job, and I didn't follow through with the recovery plans. I pushed it.
Okay.
The second one, I followed through with the recovery plans, and that's what the Tylenol and ibuprofen when I'm aches and pains are for.
Okay. Were those surgeries from a traumatic injury or just degradation over time?
Both. I was military, so there is a lot of sudden stops at the end of a parachute.
Okay.
At the same time, it's just over time.
Okay. That's fair. Have you taken any Tylenol today for your back?
No.
Do you take it 1 to 2 times a week? Do you take it 5 to 6 times a week?
Well, again, I work from home,
Mm-hmm.
so if I'm working from home and doing not a whole lot, I don't take a whole lot.
Great.
If I have to go cut grass, weed whack, and everything else, well, I take a little bit more.
Okay.
So as needed.
Sounds good. Any mental health issues for you in the past?
I hope not.
Okay.
Okay.
Are you any thoughts of hurting yourself or anyone else?
No, not at all.
Tell me about your alcohol intake. Is it daily, weekly, monthly?
All of the above. It's just social.
Social.
Hanging out with friends, football.
Okay.
I drink alone with a hot lawnmower and a hot afternoon, but that's about it.
Okay. What about tobacco use?
I do use tobacco. I have been a regular user of dip,
Okay, so smokeless
snuff.
tobacco.
Yeah, smokeless.
Okay.
There you go.
Are there any thoughts of quitting? Do you need any help with cessation today?
Not today. Thank you, though.
Well, we have lots of resources if that's something that you want to tackle in the future.
I
okay?
appreciate that.
All right, tell me a little bit about your family history. Are your parents still alive?
Both my parents are deceased.
Okay. Tell me about your mom. When did she die?
Fairly recently, about 2 or 3 months ago.
Oh, I'm so sorry.
Hmm.
What did she die from?
She actually drowned.
Okay.
So she actually was fairly healthy because she lived to a fairly older age.
Okay.
And then she had, a drowning. So
Okay. Did she have any heart disease, any lung issues?
not that I'm aware of.
any
We were
cancer?
estranged for quite a few years, but not that I'm aware of.
Okay. Tell me about your dad.
He passed away 13 years ago.
Okay. What did he pass away from?
Oh, being a bitter old man. No, quite honestly, gosh, he had chronic heart disease.
Okay.
He also had alcoholism. He had liver failure. The classic Vietnam vet syndrome.
All right. And are you exhibiting any of the signs that he has had with his chronic heart failure?
I
Not
haven't
that
been to
you're aware.
Vietnam lately, so no, I'm good to go.
That's fair. Any siblings?
I do have a sister.
Is she reasonably healthy, or does she have any medical
She's
problems?
reasonably healthy. She's a couple of years older than me, but reasonably healthy.
Okay, that sounds great.
Yep.
If you are ready, I'm ready to get started on this head-to-toe assessment.
Absolutely.
We're good for that? So the first thing I'm going to do is a set of vital signs. So I'm going to listen to your heart and lungs. I'm going to do a blood pressure, check your pulse oximetry, which shows how much oxygen you have in your blood, and a temperature. You okay with that?
Yes.
Okay, so I'm going to have you put this on your finger. You can just put that right on your, put that there. And have you put this under your tongue. And it will beep when we're all done. It's a long beep. Oh, it didn't beep, but you're done. 96.7.
Oh, perfect.
Alright, 96% there. We're gonna do a blood pressure. Okay, I want you to relax that one right on there. Sorry, my hands are a little cold. Just relax your arms.
Should turn the heat up here.
One 122/76, that's great. Just gonna listen to your heart and lungs for a second. Okay, that sounds good.
Yep.
All right, so now I'm gonna on your face, look at your head, kind of move around, check out those cranial nerves, make sure they're intact, and see if we can find anything for you, okay?
All right.
Okay, so you're gonna feel my hands here. Let me know if there's any pain or tenderness on anything I'm doing, okay? I'm gonna have you
Sure.
turn your head that way for me. Looks like you got a little scratch back here. Looks kind of recent. Is that painful at all?
No, not at all.
Okay, so I'm gonna have you look to the left, look to the right. Okay, I'm gonna touch your sinuses. Any tenderness or swelling?
No, not at all.
You said you were a little bit phlegmy. Is that a normal thing for you?
No, I think it was just a cold.
Okay. All right, I'm gonna look at your lymph nodes now, and if you're okay, I'm gonna lift your beard up
Sure.
to check out all the things. Okay, but bring your head back down. So I'm gonna go to the periauricular lymph nodes in front of your ear, and then behind your ear, submandibular, submental. No tenderness at all.
No.
So go ahead and lift your head a little bit.
Yeah, help you.
while I'm here, yeah, that'd be great.
Yeah, help you.
No tenderness or swelling.
No, not at all.
Okay, you can go ahead and release your beard. May I dive in for a little bit of a inspection here? You probably haven't had this done since elementary school, huh? But probably not a beard.
Yeah, in elementary school, my beard wasn't quite as long.
Okay, great. All right, so I'm gonna check your eye movements.
Okay.
So I want you to keep your head straight,
Sure.
and I just want your eyes to follow my pen, okay? And keep your eyes on my pen. I always get a laugh at that one. Great. Your eyes didn't twitch, no strabismus, no
Right.
nystagmus. So that looks good.
Mm-hmm.
Now I'm going to move down to your arms. Are you okay? Did your eyes stay crossed a little bit? Okay. Any problems with your arms?
No, not
your
at all.
shoulders, your elbows? Any no joint pain or swelling?
No, not really.
I'm just going to check your capillary refill. Less than 3. That's good. No rotation problems. Your strength is okay?
Yes.
Okay. Sorry, move your shirt out of the way.
Absolutely.
No problems with your joints on this side.
No.
Your skin is nice and warm.
Yes.
All right, so I want you to pull my hands towards you. Okay, now I want you to push my hands away. Okay. You can relax your hands. All right, no chest pain, no cough.
None.
You said just a little bit of a cold phlegminess, but
Sure.
nothing that you felt like in your chest
It was
necessarily.
common cold. It was
Okay.
easily cured with over-the-counter medication.
Okay, I'll listen to your heart. I'm going to listen to
Sure.
your lungs now. And I'm going to go behind you and listen to your lungs as well. Okay? Let's go up top here. Big deep breath in and out. In. Out. Again. Okay, I'm just going to come around the side of the table.
Sure.
All right, so you're in one more time at the top. sounds good. Just gonna put my hands on your back.
Sure.
Are you okay if I lift your shirt?
Sure.
Oh yeah, I see your scar here.
Yep.
Perfect. All right, Stephen, I'm gonna have you kick off your shoes and get comfy on your back on that bed. Gonna check out your abdomen next. You go ahead and lift your, bend your knees. Just a little bit easier. Is that a little bit more comfortable?
Absolutely.
Okay, are you okay if I raise your t-shirt a little
Yes,
bit?
please.
Okay. Perfect. All right, I'm gonna listen to your tummy, okay?
Yep.
Okay. No pain or tenderness when I was doing that?
None.
All right, I'm gonna go ahead and put my hands on your tummy and palpate around, okay?
Sure.
No pain?
None.
Even when I let go quickly like that?
None.
Okay. Perfect. All right. You can sit back up. Any problems with urination?
Just sometimes slightly.
Like what?
Or is that, did I screw up?
No.
Do we cut this one off?
Yes.
Okay.
I was like, that's why I was like shaking my head no.
I know. We don't have to cut, I can cut
Okay.
that. So,
So lay down and then sit back up.
and I'll fade this in. So,
So sit back up. Go ahead and
Okay.
sit back. All right, Stephen, do you have any problems with urination?
just when I drop my dick in the bottom of the toilet.
Are you kidding?
All right, one more time.
Come on. Fucking A. Come on,
That was
Steph.
the only one. Okay,
Okay.
ready?
Yes.
Okay.
Okay, Stephen. Any problems urinating?
No,
None. Okay. No urinary frequency, pain, burning,
nothing.
nothing. Okay. Tell me about your stools. Everyone's favorite subject. When was your last bowel movement?
Oh gosh, this morning.
Okay. Was it solid? Was it diarrhea?
Normal.
Normal.
Yeah.
Okay. No problems with there.
No.
You pass gas.
Yes.
Well. Okay. I'm going to examine your legs now.
Yep.
And we're gonna do the same things that we did with your hands, with checking strength and pulses and
Okay,
things like that.
sure.
Okay. So, are you okay if I
Absolutely.
touch your thigh? Any problems with your knee joints
No,
and your ankles?
none.
Nothing. Check your capillary refill. That was good. Okay, that looks good.
Okay.
I'm gonna. Oh,
Sorry.
I'm gonna have you push up on my hands, and then I want you to pull. Okay. Perfect.
Okay.
Steve, that concludes our assessment for today.
Okay.
Thank you for giving me the time to go over all my many questions. I will go let the doc know that you're ready to be seen, and we'll go from there, okay?
Thank you very much.
All right, we'll see you soon.
Thank you very much.
Okay, that concludes our healthy assessment. Now we are going to add a GU component to our assessment. Okay, Steve.
Hold on. I had a bug fly into my mustache. So you just look at the camera and then turn around and go, okay, Steve.
Okay, Steve, how is your urination? That was really awkward. Let's not. How is your urination? How is your urination?
I can write my name in the snow.
How is your urination? Okay. I think I get docked for how many times like the video stops and changes too. Just FYI. I don't think Anyway.
We can't go through the whole thing again.
we what?
We can't go through the whole thing again. We're losing light and everything.
Oh,
else.
okay. I was like,
So
okay.
go.
All right. Okay, Steve. I can't even wrap my head around what I'm trying
But
to
see,
do.
this is only one cut. It's not a big deal. We only
Yeah.
have like 3 cuts so far.
Okay.
Okay, Steve. So you
I
you,
okay.
you reported you had some problems,
Okay.
and then I can fill it in
Yes.
from there.
Well, don't fill it in too much because I have to ask you questions.
Right, but I can say, well, I'm having a problem with my urinary problems. Okay.
All right.
Whatever.
Okay. Okay, Steve. So you were telling me that you were having some problems with urination. Tell me a little bit more.
It's in the evening. It's at night when I just wake up frequently, and when I go, it's hard to get started.
Okay.
And then after I get started and finally I go, I just don't feel like I'm done yet.
Okay. Is it painful at all?
We'll go back and cut
I
this.
already forgot things I was supposed to do. I guess I can say that in my summary. I meant to have you sniff my alcohol and
Sniff your alcohol.
check your olfactory cranial.
Okay. Well, we can
I mean, that should be back in the.
but we can cut that in, right? That's right.
No.
Okay.
We're gonna watch it and then we're gonna either do it again inside or we're gonna let it ride. Okay.
I mean, we could go do it.
Should I stop this and then start again from this point? Because this will just be the last part of the. You gotta cut it in anyway.
I'm gonna cut everything. It doesn't matter. I mean,
Okay.
I don't want 15
Okay.
videos to look at.
All right. You ready?
Okay.
Okay, Steve. You were telling me that you were having some problems with urination. Tell me a little bit more.
Yeah. In the evening, usually, when I'm sleeping, I'll wake up frequently. I'll have a problem starting my flow, and then even if I can get a good flow going, it just never feels like I'm completely done.
Okay. Do you tend to notice that afterward there's a dribbling effect?
I mean, sometimes it depends on how hard I'm trying to push to get it out, or if
Okay.
I'm not pushing. But I mean,
Is it painful?
it's not painful. It's just
Okay.
frustrating.
Yes, for sure.
Sure.
Is there burning at all?
No.
About how many times a night do you think you get up?
Oh gosh. I mean, obviously depends on what I've consumed beforehand, but
Okay.
at least 2 to 3 times.
Okay. Have you ever had a prostate exam now
No.
that you're 50? Okay. That's something that we could talk to the doctor about and
Okay.
see if it's start.
No, can you guys sit out there with no coat on?
I'm
Because
videotaping
we're
my
on video.
assessment. I'm doing my homework and now I have to re-videotape it. I love you.
It's not your fault. I would have done the same thing, but we're on video, so.
We're taping. I love you. We don't normally just sit out
It's
on the
not-
massage table in
it's-
my nurse's uniform.
It's not his fault. Okay, so.
We already had to stop because the Kubota came up and we heard it.
And I saw him walking over as you're talking to me. Oh.
That's okay. You didn't know. I didn't tell you.
Well, and I saw him walking over as you're talking to me. That's why I just stopped talking. I was like,
Okay, here we go again. Take 19.
do you like my responses?
Yes, I do. But you feel like you don't. It's not a full stream, not a full.
Oh,
strength.
okay.
Okay, here we go. Ready?
Mhm.
Okay, Steve, you were telling me that you were having some problems with urination. Tell me a little bit more about that.
Yeah, I mean, in the evening or when I'm sleeping, I'll wake up, often, and I'll go to the restroom, and it'll take a little bit for me to get going. And then when I do get going, oftentimes I don't even feel like it's a full stream.
Okay.
And then even after all of that, I don't feel like I've completely voided.
Okay. Is it painful?
No,
What about burning sensation?
no.
How many times a night do you think you get it?
At least 2 or 3.
Have you ever had a prostate exam?
No.
Okay. Well, I will let the doctor know
Okay.
that we're having these problems and we'll see if we can get those addressed. As we get older, there's some preventive measures, things that we can do to kind of, make our health a little bit better.
Sure.
Prostate exams are
Sure.
one for men. Also, colonoscopies for people over 50. Have you had your colonoscopy?
No.
Okay, maybe we'll talk about that.
All right.
Okay.
Sounds
All
fun.
right. Do you have any other questions?
Not at all.
No? Okay. Well, I'll go let the doctor know that you're ready to be seen, and I'll go over my assessment with the doctor,
Okay.
and we'll be back in a few minutes. Okay?
Thank you very
Okay,
much.
Thank you, Steve.
Appreciate your time.
Thank you.